Therapy. And Alana, thank you again for joining me tonight for another session of Facebook Live. I just wanted to tell you a little bit about myself first. My name is Todd Thoughton from Thoughton Physical Therapy in Attleboro, Massachusetts. I'm very active, I love working out, and I love to race triathlons. I've been a physical therapist for over 20 years, and I've had the pleasure of working with many amazing physical therapists over that time. I myself treat patients about 20 to 30 hours a week, and then run the business the rest of my time. My purpose and passion as a physical therapist to ease suffering for all my friends, my family, and for those who are in my life is really important to me. My real passion is the mindset portion of why people have pain and why they are not reaching their goals. So I really feel that's what makes me different, is bringing the mindset portion to the physical therapy treatments. My purpose for doing the Facebook Live is I realized that I really love treating patients, but I wanted to have a bigger reach. I wanted to reach the biggest amount of people that we could, so I've decided to share my experience on a bigger stage. I wanted to give you as much content as possible so that you'd be able to share that with your friends or family. If you have any questions about physical therapy, about any of your injuries, then we might be able to help out you, a friend, a colleague, or a family member. So as the PT, tonight's episode is about back pain, something that is probably one of my favorite topics, because I believe as a physical therapist that every issue related to the lower body has a huge impact is related to the low back. Over 90% of Americans have back pain. That's a staggering number, amazing amount of people that will have back pain over their lifetime. And unfortunately, many of them get misdiagnosed and don't get the proper treatments over that time. So the general anatomy, we've spent a lot of time talking about. We have the low back, we have the glute muscles, we have some of the other low back, the paraspinal muscles. We have the ones that everyone knows about the abdominal muscles, and then we have the thigh muscles as well. But nerves are where I was just going to turn some of my focus to. Nerves do three things. They tell us where there's pain. They allow sensation. We might have numbness and tingling, and they also give us juice to the muscles to work. Those are the structures that I'll be talking about tonight. So what I first want to talk about was to explain just a couple different types of back pain that someone might experience, and hopefully some of you can relate to some of these back pain issues. The first one is just a general low back pain, which is usually more muscle related. Some of the signs and symptoms are general low back pain, occasional numbness and tingling down in the legs, usually caused by lifting improperly, a different job that you may have, not working out regularly, or say a weekend warrior. The treatment for that would definitely be to do a thorough assessment first to find the starting point where we're at, and to work on an initial core conditioning program, some hands-on techniques, and then I believe in the test-retest method, which means so we'll do something, we'll test it, then we'll see if you've benefited by retesting and see if we've got the outcome that we wanted. The next type of back issue would be in someone that has arthritis in the low back. Very, very common. Most people have arthritis in the back, in the spine, whether it's in the neck or the back. And that can present as just general low back soreness caused by wear and tear over time and just by the aging process. The treatment for that is also going to be to find a thorough starting point, start with an initial core program, some hands-on techniques, and also the test and retest method. Now we're going to get to the ones that are very, very common for people, bulging disc. So for those of you who don't know what a bulging disc, I just want to explain about that. So if I have, this is the lumbar spine, the low back over here, we have the 5 vertebrae in the low back, and then we have the sacrum. In between the vertebrae, we have discs. And this would be an example of the red, if you can see right here. This would be an example of a bulging disc. As we see the disc is near and can pinch the nerve. So we have the vertebrae, the discs, bulging discs, and the nerve. Why is a bulging disc important? Well, if you want to think of it, if my hands were the 2 vertebrae and the disc was in between, you want to picture kind of, we'll say like a water balloon. When we bend forward, the disc is going to want to come out backwards. When we go in backwards into extension, the disc is going to come forward. Usually what happens in a bulging disc issue is over time, the sac that holds the disc in place, we'll say it's round, is that through the wear and tear of it moving forward to backward, it kind of it thins out the walls in the disc, and then the disc kind of bulges out a little bit. So we usually see the symptoms if people have a bulging disc. It's usually on one side. So that means that either your right leg is affected or the left leg is affected. Common symptoms that people might feel with a bulging disc is low back pain. They might have pins and needles down the leg. They might have weakness, or they might not have any low back pain at all. Most people, as they get older, have bulging disc, whether or not they've had an MRI or not, to have it actually documented. The treatment for bulging disc, like I said, if we bend forward, the disc is going to want to push out backwards, which is going to irritate and send the symptoms down the leg. And remember, if the nerve is affected, it's going to potentially cause pain, numbness and tingling, or even a loss of strength in the legs. The next one is called a herniated disc. And what is a herniated disc? Well, we'll take the bulging disc. What happens is by the repetitive motion forward to backward, whether it's a job-related thing, it's usually not a specific term, it's usually wear and tear, is that the disc bulges out so much, it's almost like it just gets a flat in where the disc actually opens up and some of the fluid can come out and it can come and affect the nerve. Another name for herniated disc is a ruptured or slipped disc, which is, again, very common, a common name that people have seen. The signs and symptoms of that are severe low back pain, buttocks pain, and thigh pain as well. The treatment, the symptoms, the things that we would want to avoid are flexion exercises, which are going forward because that's going to kind of push the disc out even more, affecting one leg. And what would we do for treatment? Again, avoid flexion exercises. We want to do a thorough assessment of the patient to find out where their starting point is, do some core exercises, some hands-on techniques, and also use the test-retest method. The next one is a compression fracture. Compression fracture is when the vertebrae have a crack in them, and that's usually just related to osteoporosis, one of the common culprits. And the treatment for that would be to make sure you have some regularly checked on x-rays to make sure that the compression fracture is not getting worse, and also do physical therapy to restore the muscle strength and function. Now, the next one is going to be stenosis. Stenosis is a very common low back issue, and all stenosis means is it's an abnormal narrowing of a pathway. So in this case, along the spine, it would be an abnormal narrowing of the area where the nerves go through. Very, very painful. Stenosis is a very painful thing. This usually happens a lot later in life, 50, 60, 70 years old. The signs and symptoms of that would be pain in the back, significant pain in the legs, the thighs, the buttocks, that worsens with standing, where they might get muscle cramping and weakness, and also pins and needles. Again, this is just caused by wear and tear in the body and also inflammation. Again, the treatment for that would be just a thorough assessment to find the starting point, and then a core conditioning program, hands-on techniques, and also the test-retest method. The last one I'm going to talk about is sciatica, which is just inflammation of the sciatic nerve. As we have the 5 vertebrae in the lumbar spine, they have nerves that come off on each side to come down and form the sciatic nerve. The sciatic nerve is about the size of your pinky. So if you look at your pinky, it's about the diameter of your pinky. If we have pressure from a bulging disc or a herniated disc, that's going to push on the sciatic nerve, which can give you symptoms all the way down into your foot. One of the things we want to avoid with sciatica is excessive flexion, like we talked about, focusing more on the extension principle of the low back. Now, if you have any of these symptoms or any of these different types of back pain, what is a reason that you think you might really want to go to the emergency room, or if your low back pain is an immediate emergency that you want to get it taken care of? This is very important. If you have a loss of bowel or bladder function, if you have progressive leg weakness where it just keeps getting weaker and weaker and weaker, unexplained weight loss where the leg weakness is getting more and more, you have acute stomach pains or acute low back pain that just does not resolve, and you might have a fever in which the fever gets worse even with medication, or it doesn't change even with medication. A lot of times I'm finding when many patients come into us that there is really no cause for their back pain. They really can't place a specific incident of trauma to it. So it's our job as a physical therapist to ask the right questions. By asking the right questions, then we start to do an assessment. We're going to notice that a big culprit is poor posture, so something that we really need to work on with the fuse box idea that I was talking about before, which affects the nerves. Another thing is straining a muscle or ligament, usually by someone not being in shape or not warmed up enough before they do exercises. That's another problem. Then we have a whiplash or trauma when there was a trauma to the person, a slip, a fall, car accident in which there was a trauma to the body, very common. But I think one of the more important things that I see is that usually people start or initiate an exercise program without knowing where they are. They don't have a roadmap. So they're starting something too aggressive, too quick, because they might find an exercise that's shiny or that everybody else is doing in the gym. That is probably one of the biggest problems that I see. And the last thing is that people don't really listen to the warning signs that their body have, which is really important. So now I can tell you, so excited, what do I do as a physical therapist for patients? Well, I'm going to break it down into 3 things because people like 3 things. I know I can remember 3 things pretty easy. It sounds kind of silly, but the first thing I need to do is a thorough assessment. And by that I mean, I need to find out where is that person starting. If I was to give someone a roadmap of how to get from here in Attleboro to Boston, and they knew where they were starting, then we can go to Boston, and we're going to take the map, and it's going to get us there. But if I didn't know where the starting point was, and I dropped someone in the Midwest, and I said, go to Boston, if they don't have a clear starting point, they don't really have a way to get there, and they might not make the best decision on how to get there. So first, finding the starting point, and what do I mean by that? I'm going to look at how the neck moves, I'm going to look at how the cervical spine moves. I'm going to look at how the mid-back moves, and I'm also going to look at how the low back moves. I'm going to take a look at how the pelvis and the SI joint move, and I'm going to take a really good assessment of the core and how strong are they in their abdomen and their low back. The second thing I'm going to take a look at is their posture. I'm not only going to look at their posture, but I'm going to explain to them why is their posture crucially important to them to stop and avoiding other injuries that they might have going on. And I'm going to talk to them about making sure that we activate the right muscles by initiating the core and the core conditioning program to activate the muscles along their spine, which will in turn increase strength all the way down to their arms and their legs. The next thing for me as a PT is I rarely have anybody stretch. I have stretched, I don't remember the last time I had somebody stretch, because I found over beta testing my thoughts and theories over the last couple of years that as long as I'm activating the right muscle groups in the right order, the right progression, and the people are staying consistent, then the muscles actually just relax on their own. And the last thing is I really believe in the test and retest method. So if you were to come in and see me as a physical therapist and you were working one-on-one with me for 30 minutes, I'm going to try a different technique, then I'm going to have you get up and walk around. How did you feel? How did you respond to that? Or if we give you an exercise, how did that feel? How did you respond? I'm going to, and because I don't want to wait till the end of the 30 minutes and find out that it didn't help. I feel like I've wasted the treatment at that point. So Todd's words to live by. Whenever I have a patient come in, there's another 3 things that are really important to me. The buy-in. I want to educate the patient to make sure that they know what's going on with the diagnosis, to know why they need physical therapy, to know why it's important for them to continue doing their exercise at home. The second thing is less is more. When I first started as a physical therapist, I would give people 10 to 15 things to do, and then I realized that they weren't really doing it as much because it was too overwhelming. So less is more, and again, people like to do, for whatever reason, they like things in the groups of 3. And the last thing I like to share with the patients is everything is a 1% to 2% change. To be committed to staying with the program, it doesn't take much to make a huge difference on the other side of getting better, but it has to be consistent. When people come to us with low back pain, it's likely that they've had low back pain for even longer than they can imagine. So it's not really realistic that they can have the back pain gone just like this in a few visits. So those are the 3 things. So buy in, educate the patient, less is more, and everything is a 1% to 2% change, which to me works on the mindset of patients. So I want to thank everybody that's written in over the last week, or people that I've come in contact with some great questions for this week. So if you have any questions online too, please feel free, if you're watching right now, please feel free to type in with any questions and I'll get to those. And if you have any questions too, you can also reach me at todd@houghtonphysicaltherapy.com. I really appreciate the last couple of weeks, actually, since we've started, that there have been quite a few, it's been really good dialogue, even after the session there, where people ask some questions. It's fantastic. The first question is, are scans necessary to determine which lower back ailment it is, or can a PT determine this? That's a great question. Thank you very much for that question. Through my eyes, whether someone has an MRI that's positive, whether they have a bulging disc or herniated disc or stenosis, it's not really going to change what I do for treatment from my perspective, because I'm going by how did they respond to my treatment. Even if I had 4 or 5 people that have a bulging disc, I might treat them completely different. So for me and for other physical therapists, it is good to have an X-ray or an MRI if that's what you think you need, but it's not really going to change what we do, so it's not necessary. If you were thinking of having a surgical intervention, I would definitely suggest it at that point, but it's not necessary to be able to attend physical therapy. Next question, I had sciatica. Thank you for the question. I had sciatica during pregnancy and then it went away. I feel like I may be coming back. Is that possible? That's a great question too. It is possible that sciatica can come back if the root cause wasn't really addressed. That's 2 things. One, if the root cause wasn't addressed, and I would make sure, did you follow up with all your exercise and continue with them? Because what we see very commonly is people think when they're better, they can just stop doing things altogether. But the idea is, I found through my experience that, especially low back exercises, low back issues or injuries, they can kind of be progressive. So they might be at bay for a couple of years, but when they come back, they're usually a little bit worse than the last time if you haven't kept up with any of your exercises. So that is really, really important to be able to follow up with that. So it is possible that it could come back. I would take a look at, again, your posture. I'd take a look at your workplace setup. I would take a look at your car setup. There's a lot of things that we can do that, again, just that 1 to 2% change can really make all the difference in the world. Next question. Thank you for that question. The next question. I've heard that a person can slip a disc by multiple actions like sneezing or bending to tie a shoe. Is that true? That is absolutely true. A lot of times with a herniated disc over a bulging disc is that a herniated disc, you can relate one trauma to it. But over my years, I really feel that we could have predicted that at some time even before. It's likely that the person had a back issue for a while. It's likely that they had a nerve that was irritated before. So this is just the straw that broke the camel's back, just the thing that just put them over the edge. So yes, sneezing, coughing, and especially if someone has a herniated disc or a bulging disc, those even during the treatment can cause some significant pain. The nerves, again, we know that they do what? They control our pain. They give us input for sensation, and they also give us juice to the muscles to work. When a nerve is irritated, it can take a lot to calm it down, and it can take a long time for it to even feel better. So those are some common things with nerves. Hi, Emily. How's it going? Thanks for joining. Next question. I notice that I am tripping when I walk upstairs. I've twisted my ankle, but my back does not hurt. Are these all related? That's an excellent question. One of my favorite topics. I would say yes, they are all related. In your spine, we talked about there are 5 vertebrae in your low back, and one of them is responsible for, the 4th vertebrae is responsible for lifting your foot up, like as if you would lift your whole foot or your ankle up in the air, if you lift all your toes up in the air. So if you have a back issue at L4, a disc issue at L4, it's going to limit the ability for you to produce force by lifting your foot up, which when you walk through, it's going to seem like you're dragging your foot and you can catch your foot and trip. Also, to go along the lines with the fuse box theory is that if we're putting pressure on the nerve, because one of the big things that it does is controls the juice to the muscles to work. So if you're having a low back issue, you're not getting, and you're bent over, your head's down a little bit, that you can notice that your foot at the end of the day can get fatigued, you can trip. You might have been able to clear a threshold for 20 years. Now you have this back issue and you notice that you're starting to trip. A lot of times too, I'm finding that I can relate 100% of low back injuries causing anything in the low body. If someone has an ankle sprain, I can tell you that their low back is weak, and it probably was a precursor, and we should have been able to predict that an ankle sprain could have been caused because of a weak core issue. I'll go as far as saying if we don't address the low back, then the ankle sprain is going to become a chronic thing. Great question. And Karen, thank you for the question. What is the best low back strengthening exercise? Well, the most important thing, thank you for the question, Karen. The most important thing would be to find out where the starting point is, like I talked about before, a thorough assessment to find where are we starting, so we can give you the best roadmap possible. So given that you don't have much of an imbalance, I think the biggest one, or the biggest bang for the buck, or the money move, would be the Superman exercise when someone's lying on their stomach, hands behind their head, where they squeeze the shoulder blades together, squeeze the glute muscles, and lift up their arms and the legs up off the table, but only to a position when you're straight like a plank. We don't want to hyperextend, and we don't want to arch your back when you're doing it. So working the Superman exercises, because you're going to get the upper back, you're going to get the whole fuse box, you're going to get from the neck, you're going to get to the upper back, and also the low back and the glutes, which are crucial to increasing the activation to the muscles in the low body. For the abdominal muscles when you're lying on your back, we would want to activate the abdominal muscles, the core muscles, and you could do like a heel slide. You can also do some marching in place. And I really believe that we have to find really what the starting point is and start off with the basic exercises to be completed consistently. I'd rather have somebody do an exercise 5 minutes, 5 times a day, as opposed to one 20-minute block, because we need to keep turning on the activation of the muscles that need to be worked. So hope that answers your question. If not, you can please feel free to reach out to me on Facebook, and I can give you a call personally, and I can give you some more information if you need. Or you can just email me as well, todd@HoughtonPhysicalTherapy.com. Thank you for that question. It's a great question. I have pain, the next question is, I have pain in my left leg, especially when I sit down. When I'm sitting in the car, I have to lift up my foot to apply the brake. The pain is excruciating. What do I have going on? Well, one of the things that we talked about before is most of the low back, whether it's a bulging disc, whether it's a herniated disc or sciatica, the things that bother it can be sitting or slouch position. Because when we sit or when we slouch, we're putting tension on that nerve, which can send a shock wave all the way down your leg, all the way down to your foot. So I would say you probably have a disc issue. It could just even be the compression. The sciatic nerve comes out of your back, runs down through a muscle in your hip called the piriformis muscle, runs close to it, comes down the back of your leg and goes all the way down to your ankle. I would say that it sounds like you have a disc issue. I would definitely get that checked out, because that can be really, really painful, and it doesn't have to be that way. I would also look at the seat position in your car. Is that something that's aggravating it? I'd look at the seat position in your office, or if you are at work or at home. Make sure that you're not spending a lot of time in a slouch position with any disc issue that's going to really irritate your back. And then anything you're going to go do from that point is going to be very painful. That's a great question. Thank you. Karen, you're very welcome. I hope that helped out. Hi, Cindy. How are you? Jojo, nice to see you back again. Jojo's question, should a person who has experienced low back pain do the Superman or wait until the pain has subsided? I guess it really depends what kind of pain that they're having. That's a great question. I would say that I would want to have them assess to see kind of why are they having the low back pain and what motions bother it. I would probably say the Superman would probably be a little bit too advanced at that point. I would probably start off with lying on the stomach and just doing some glute squeezes to activate the glute in the low back. Then I would progress to like a single leg raise in the back as opposed to both legs coming up. Then I'd break down the glute squeeze, I'd break down just the leg exercises, then I would break down upper body exercises. And if all 3 of those can be done without a problem, then I would add in the Superman. But the bigger point of your question is, would you wait until the pain has subsided? I'm really a firm believer, for me as a physical therapist, through my eyes, I never have anybody stop working out. Very rare. I don't remember the last time it happened, because I think the body just needs to move, and mentally, if you don't move, I know for me, because I like to work out a lot, Jojo, as you know. Oh, and those triathlon socks you got were fantastic. I love wearing them. That when we stop working out, to me, it gets to me, and then you don't really feel so good, and you're not really in a good state. So I would say that I would find a way to work through the discomfort, but again, it's coming up to find where is the starting point. Super important. So hopefully that helped, Jojo. Great question. Hi, Nancy, how are you? Welcome back again, and I love that you're tuning in. Thank you. Next question. Is the lower back the most common area for disc damage? Why or why not? I would say that between the low back and the neck are really, really common for disc injuries. We see, very rarely do we see one in your mid-back, which is your thoracic spine. I'll say we have 5 vertebrae in your low back, and for the most part, it's the 4th, the 5th, and then the 5th and the 1st sacral vertebrae. That's where usually the bulk of the disc injuries are. And also in the neck, it's usually more, we have 7 vertebrae in your neck, and it's usually more of the lower ones, C6, C7, and then the 7th and the 1st thoracic. So that's usually where we see most of them, but I would say the low back is the most common injury. And another thing is that, again, with 90 people having back pain, that's a significant amount of people. And if we were to do an MRI, I'm going to say the majority of people would definitely have some type of pathology going on there. Another point is that just because you have a disc injury, a herniated disc avulsion, just isn't the end of the road. There's a lot of things that we can do to help that out. So just because you have that, I don't want you to be terrified to do anything. Again, the answer for me is never, to JoJo's question, is never to just do nothing, because that doesn't work. Because when you start up a new exercise program, you're going to revert back again to the same thing. It's a great question. Next question. My daughter is 4, and she slipped off the end of the slide and landed on a tailbone. I'm sure a lot of parents and have seen that happen, as well as a lot of adults. Does not feel good. Now, she can't bend down without crying in pain. What could this be? If there is damage this young, will she have trouble later? That's an awesome question. Even though kids that are 4-year-olds or 4 or 5 as a younger, they're kind of like pieces of rubber. They just kind of bounce along. But even then, there must have been a pretty traumatic injury. When someone has any issue with their tailbone, that's a really, really sensitive area. It usually takes a long time for the tailbone to heal. It can be bruised for a long time. But more importantly, where we have the sacrum, which is the part of the, which is kind of where the tailbone attaches in the back, and then we have the pelvis on both sides. Whenever we have the tailbone injury, it can affect the SI joint, the sacroiliac joint, which is the 2 bones, if anyone feels in their back, the 2 bones on your low back. We can have some torsion of that, or things can kind of shift in the pelvis, which can cause significant pain into the low back. Any problem with the SI joint can cause pain down your legs, pain in the pubic bone, many different things that can happen. A lot of times when the symptoms have been there for so long and the trauma's been there for so long, we get a lot of scar tissue built up. But the good news is, no matter how old they are, this is something we can definitely work with. Something definitely, even doesn't matter how old she would be at this point, chances are she probably has a lot of pelvic and low back issues as a result of the fall, but it's definitely something you'd want to get checked out, because we will definitely be able to help her out. So I want to thank everybody for tuning in tonight. I hope this was helpful. The low back is one of my favorite topics to talk about, because it's the epicenter of, in my eyes, every lower body injury, whether it's a hip injury, a knee, IT band, piriformis, calf, Achilles, foot, plantar fasciitis, or ankle pain. To me, it's a huge part of any injury, and it's got to be addressed with everybody. If you have any questions, you can please feel free to reach out at todd@HoughtonPhysicalTherapy.com. If you could share this post to anybody out there, share it on your page, that'd be great. Again, the reason why I want to do this is I just want to have the biggest reach, and I want to share the information. Hopefully this was helpful to everybody tonight. Look forward to seeing you next week for another favorite topic of mine, which is neck pain. Who doesn't have neck pain, right? A lot of people do. So again, thank you very much for tuning in. Have a great week.